For many couples, trying to conceive can quickly turn from something exciting to a frustrating experience. So in this morning's STL Moms Report, Fox 2's Molly Rose is talking with a reproductive medicine physician. Molly?
Yeah, this morning we are joined by Dr. Kenan Omurtag with Washington University Physicians. Doctor, thanks for being with us.
Thanks for having me, Molly. Good to be here.
So we would love to know if you could break down what are a couple of those things that do play into fertility, and how do both men and women play a role in this?
Well, it's a good question. 1 in 8 couples struggle with infertility, so there's a good chance someone in your immediate friends and family orbit is struggling with infertility. We know 40% of couples who walk into a fertility clinic struggle with an ovulation problem. That means the woman doesn't release the egg as predictably as one would think. And we know that up to 50% in some studies of men have a male factor. So there's something wrong with the sperm. The reality is many times there's small factors from both partners that can be responsible. But it affects a lot of people, and it's being talked about more, and that's a good thing.
I think a lot of people might wonder too, how long do you try before you go get checked out and see if everything is in order?
So definitely, if you've been having unprotected intercourse for more than a year, you want to seek a workup from either your OBGYN or a reproductive infertility specialist. Make sure the sperm is okay, make sure the tubes are open, make sure you are ovulating. If you are 35 years old and above, you want to definitely be starting that workup after 6 months of unprotected intercourse, because as the age of the woman increases, you want to have a greater sense of urgency.
What are some of the resources these days? There's just so much new stuff all the time. People who are looking into getting assistance or help, what do they have? What are their options?
So there are a lot of places. I think first start with your OBGYN. If you don't feel like you're getting the answers you want, definitely reach out to a reproductive endocrinologist. A board-certified reproductive endocrinology and infertility specialist is key. There are a lot of resources online. One place to start is resolve.org, which is kind of the national infertility organization. WashU Fertility has an Instagram account that provides a lot of information. I do at Dr. Kenan Omurtag, MD, that provides a lot of fact-based, evidence-based information, because there is a lot out there about infertility, how best to optimize, what are the best treatment options, etc. And really the question always is the answer is always an individualized one, because everybody's situation is complex
and
unique.
As we kind of close out here, I know you had some tips on couples who are just getting these kind of awkward and nosy relatives who are constantly asking if they're trying. What's your advice to those people and to those relatives?
Yeah, so to the patients who are struggling with infertility, definitely when you go to that family function or that dinner, have a plan with your partner on how you're going to address those questions, those awkward moments. Make sure you're kind of united on that front. It's okay to say, you know what, this isn't a good time to talk about it. I'd like to talk about it in private. For those family members, friends who want to be inquisitive, if you're going to ask, please, hey, why does this person not have a baby yet? And there's probably a good reason. Again, 1 in 8 couples struggle with infertility. So if you got to ask in private. Don't make the conversation about you. It's about the patient. It's about the person that's struggling. Listen to their story. Listen and go at their pace is my advice to family and friends who might be inquisitive.
Such a good reminder to be sensitive around this topic. Dr. Omurtag, thank you so much. We appreciate your time today.
Thanks a lot, Molly. Appreciate it.